18 U.S. states now allow the use of medical marijuana, and people in Colorado and Washington state recently voted to allow limited possession of pot for non-medical use. That's a paradigm shift in a country that until recently criminalized the use of recreational drugs.
Public enemy number one in the United States is drug abuse.
It started in 1971 with President Richard Nixon declaring a war on drugs. He was responding to growing addiction across the country, mainly in poor inner-city neighborhoods. In July of 1973, Nixon signed an executive order creating the Drug Enforcement Agency, or the DEA, a unified single command to lead that war. More than 40 years later, the U.S. government has spent $1 trillion to arrest and prosecute drug dealers and users. Today, as many as 500,000 people are in U.S. prisons for violating drug laws. That's roughly the population of the city of Toledo, Ohio, behind bars. Many are serving long sentences, including people caught with only small amounts of marijuana, cocaine, or heroin. Despite the tough laws, the World Health Organization says Americans lead the world in the use of illegal narcotics. But the U.S. government still insists its interdiction policies are working.
650,000 fewer teenagers are using drugs today than a decade earlier, and that's a 15% decline. The balanced drug strategy that we have has played a role. We also see the same corresponding drops in adult drug use. So we are doing something correct with our drug strategy.
Critics disagree, saying there were less than 500,000 addicts in 1971 when the war on drugs began. Some estimates now put the number of U.S. addicts around 5 million. The DEA says Americans spend approximately $65 billion a year on illegal drugs and admits it is a very hard business to shut down.